I have to tell you something, and once I say it, I cannot take it back. After more than 20 years standing in rooms with patients, holding charts that were about to change someone's life, I have to be honest with you. There is something happening in medicine right now that almost nobody is talking about, and it is hurting people, especially people over 60. I'm Dr. Susanna Sevelt, and what I'm about to tell you might be the most important 30 minutes you spend this year. Because by the end of this video, you are going to look at every single medical test differently. You will never walk into a doctor's office the same way again. Here is the secret nobody hands you a pamphlet about. Sometimes, the test itself is the danger. Not the disease, the test. I know how that sounds. You've been told your whole life, more screening, more checking, more catching things early. That's good medicine, right? Stay with me, because what I'm about to show you flips that completely upside down. And once you see it, you cannot unsee it. There are 4 tests, specific ones, that I watch destroy healthy people's lives every single week. Not because the tests are bad tools, because of what happens after. And I promise you, by the time I get to test number 4, you will understand why I almost didn't make this video. But first, you need to understand one mechanism, one chain reaction. Doctors have a quiet name for it. We call it the cascade. Once you see how it works, you will recognize it everywhere. Picture this. You feel completely fine, nothing wrong. You go in for a screening just to be safe. And somewhere on that scan, something shows up. A spot, a shadow, a number slightly off. Now here is the part nobody warns you about. That spot might have been sitting there for 20 years, harmless, and would sit there for 20 more without ever touching your life. But once it's been seen, it cannot be unseen. The doctor is now obligated to act, because what if they don't, and it turns out to be something? So you get sent to a specialist. The specialist orders a sharper scan. Still unclear. Now we're talking biopsy, maybe surgery. Every one of those steps carries its own risk. Infection, bleeding, sleepless nights, lost months. And here is the gut punch. 9 times out of 10, it was nothing. It was never going to hurt you. But now you've lived through fear, procedures, maybe complications, and you are walking out worse than you walked in. All because of a test you never needed in the first place. That is the cascade. And it starts with one single test, taken on a day you felt perfectly fine. Now let's talk about test number 1. And this one is sneaky because it sounds like the smartest, most modern thing you could possibly do for your health. The whole body scan. Full body MRI or CT. The kind that promises to check everything, head to toe, in one sitting. You've seen the ads. Catch it before it becomes a problem. Doesn't that sound like exactly what a responsible person should do? Here's what actually happens. Say you're 65. You feel great. Active, no symptoms, nothing wrong. You get the scan just to be thorough. 2 days later, the report lands in your inbox. And there it is, a small nodule in your lung. 3 millimeters, about the size of a pencil eraser. Or a cyst on your kidney, a spot on your liver. The report says, recommend follow-up imaging in 3 to 6 months. How do you feel reading that sentence? You walked in healthy, you walk out, and suddenly every breath makes you think about your lungs. Every twinge in your side makes you think about that kidney. You cannot unring that bell. 3 months later, back for another scan. Maybe it's the same size, maybe slightly bigger, hard to tell. The specialist, being thorough, recommends a biopsy. And a biopsy is not nothing. Anesthesia, a needle going into your lung or your kidney, wherever this thing is hiding. Risk of bleeding, risk of infection. And here's the part that should stop you in your seat. When researchers scan healthy people over 60, they find something unusual in almost everyone. 90 to 95%. Little spots, little shadows, little cysts. We call these incidental findings, things we found by accident, and the overwhelming majority will never cause a single problem in your life. They are simply what a body looks like after 60, 70 years of living in it. Wrinkles on the inside. But the moment we see them, we cannot look away. And that's exactly when the cascade begins. There is research tracking this. People who got these full body scans were compared to people who didn't. The scanned group did not live longer, did not avoid more disease, but they had significantly higher rates of anxiety, depression, and unnecessary procedures. The scan didn't make them healthier, it made them sicker. So what do I want you watching instead? Forget the picture of your insides. Watch how your body actually performs. Can you climb 2 flights of stairs without gasping? Can you rise from a chair without your hands? How's your balance when you turn quickly? How are you sleeping? These functional signs tell us far more about your real health than any scan ever could. Now, stay with me because what I'm about to share next might be the part that affects the most families watching this right now. And before I go further, if any part of this is hitting close to home for you or for someone you love, do me a favor and hit follow, because I'm going to keep walking you through exactly what to ask your doctor before you agree to anything, and you don't want to miss what's coming. Let's move to test number 2. And this one touches a fear almost everyone over 70 quietly carries. Memory. Maybe you're in your mid-70s. You forget the name of an actor you love. You walk into a room and forget why you went in there. Completely normal, the kind of thing that happens to every aging brain. But your children hear about it, get scared, hear the word Alzheimer's in their heads, and push you toward a brain MRI. Just to check. I understand that fear completely. Nobody wants to think about losing themselves. But listen carefully because this matters. Getting a brain MRI for mild forgetfulness is almost never helpful, and it is often harmful. Here's why. The scan comes back and the report uses words like mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. Words that sound like your brain is falling apart. But here's the truth those words hide. Those findings are completely normal for someone in their 70s. It's like scanning your skin and being shocked to find wrinkles. Of course there are wrinkles. That's what skin looks like at 75. The problem is, medical language doesn't sound normal. It sounds like disease. And suddenly you're convinced Alzheimer's is creeping toward you, even though nothing is actually wrong. Here's a number that should genuinely shock you. When researchers scan the brains of healthy people over 75, more than 90% show findings that look abnormal on paper. More than 90%. And most of those same people have perfectly sharp memory and thinking. I have personally seen patients sharp as a tack, doing crosswords, managing their own finances, whose scan looked alarming. And I've seen patients with early dementia whose scan looked almost untouched. The picture and the person do not always match. So what should you actually do if memory worries you? There's a far better test, and it takes 10 minutes right in the office. We ask you to remember 3 words. Draw a clock, count backward from 100 by 7s. Simple, but it measures how your brain functions, not just how it looks in a photograph. And here's something I wish every family knew. Most memory problems in older adults are reversible. A medication causing fog, low vitamin B12, undiagnosed depression, which often disguises itself as memory loss in seniors. Sleep apnea quietly starving your brain of oxygen at night. A sluggish thyroid. We check all of this first, and you would be amazed how often fixing one small thing brings the memory right back. No MRI required. Now, if someone is genuinely declining, getting lost in familiar places, unable to manage money anymore, that's a different story. And a full workup, including imaging, absolutely makes sense. But for everyday forgetfulness, the MRI often creates more fear than it resolves. Test number 3 is going to surprise you because it sounds like pure common sense. The cardiac stress test. Just because you've crossed a certain age. Picture this. You're 72, heading in for something routine, maybe a hernia repair or a knee replacement. Hospital protocol says everyone over 70 gets a stress test first, even though you walk 2 miles a day without a flicker of chest pain. Stop and really think about that for a second. If you can already walk 2 miles in your actual life with 0 symptoms, what exactly is a treadmill going to tell us that your daily life hasn't already proven? You are already passing that test every single day without anyone watching. But protocol is protocol, so you get on the treadmill. And here's where it turns. Stress tests in older adults have a notoriously high false positive rate. The test says something's wrong when nothing actually is. Could be your heart rate response, could be medications, could be a dozen harmless reasons. But once that result comes back abnormal, you are now on the conveyor belt. A cardiac catheterization gets scheduled, a tube threaded through an artery all the way to your heart. Invasive, real risk. And often, they find exactly what you'd expect to find in a 72-year-old heart. Some plaque, some narrowing, nothing that needed a stent, nothing that was about to harm you. But now you've had an invasive procedure. You've been labeled a heart patient, new medications, and the real damage, the quiet damage, the psychological kind, has already happened. Maybe you used to play tennis. Now you're afraid to even raise your heart rate. The test meant to protect you just stole your confidence. So what's the better path? Listen to your own body, because it is the most honest stress test there is. If you can climb stairs, walk briskly, do your normal life without chest discomfort or unusual breathlessness, your heart is telling you it's doing fine. Watch for the real warning signs. Chest pressure with exertion, sudden, unusual shortness of breath, dizziness. Those get checked immediately, no hesitation. But if you simply want to know your future risk, there's a far smarter tool, a coronary calcium score. A 5-minute CT scan, no treadmill, no needle, very low radiation. It measures the hardened calcium in your arteries and gives you a single number. Near 0 means very low risk for years. A high number means it's time to get serious with diet, movement, maybe medication. The difference matters enormously. The calcium score informs you. It does not automatically drag you into a cascade of invasive procedures. It hands you a choice instead of forcing your hand. Woven in, I have to say, I did not expect to be sharing some of this so plainly, but I think you deserve the truth. If this is changing how you're thinking about your own next checkup, stay with me, because what comes next, test number 4, is the one I almost left out of this video entirely. Make sure you're following along so you don't lose this. Test number 4. And I will be honest with you right now. This is the one that's going to ruffle the most feathers in my profession. Routine colonoscopies after age 75, when your previous ones were clean and you carry no special risk factors. Let me be crystal clear before you misunderstand me. I am not against colonoscopies. They are a remarkable tool. I recommend them starting at 45 or 50 without hesitation. They prevent colon cancer outright by removing polyps before they ever become cancer. If you're in your 50s, 60s, even early 70s and one is due, please go get it done. But every single medical test is a balance scale between benefit and risk. And that balance quietly shifts as we age. The benefit of a colonoscopy is preventing a cancer that, even if it forms, typically takes 5 to 10 years to become dangerous. So if you're 78 or 80, is that benefit still worth the risk sitting on the other side of the scale? Because the risks climb with age. The PrEP alone, that brutal liquid keeping you up all night, can leave an older body dangerously dehydrated and weak. Sedation carries a higher risk of confusion or breathing trouble in older patients. And then there's the one that keeps doctors awake: perforation, a tear in the colon wall. As we age, that wall thins, and the risk of the scope tearing through it roughly doubles, even triples after 75. A perforation is a surgical emergency. Often it means emergency surgery, sometimes a colostomy bag. For an 80-year-old, that single event can end independent living completely. Now, weigh that against trying to prevent a cancer that wouldn't even become dangerous for another 5 to 10 years. If your life expectancy is shorter than that window, the math simply doesn't favor the procedure. You become more likely to be harmed by the colonoscopy than saved by it. That is exactly why most current medical guidelines say routine screening can stop somewhere between 75 and 85. This is not one size fits all. Family history of colon cancer, prior polyps, inflammatory bowel disease, that changes the entire calculation. But for the average healthy person with no special risk, continuing routine colonoscopies every 5 or 10 years deep into your 80s is, more often than not, doing more harm than good. So does that mean ignore your colon completely? Absolutely not. It means shifting from invasive screening to smart, attentive watching. Pay close attention to symptoms, persistent changes in bowel habits, blood you notice, unexplained abdominal pain or weight loss, new anemia. Any of those, age becomes irrelevant. You need answers immediately. And use the single most powerful tool you already have access to: fiber. Fruits, vegetables, beans, whole grains. Fiber feeds the good bacteria living in your gut, and those bacteria produce compounds that protect against inflammation and cancer. More lentils, more broccoli, more oatmeal, more apples. Protection for your entire body with zero risk and zero needles. So there you have it, 4 tests, each one sounding responsible, modern, even loving on the surface. Whole body scans that uncover problems that were never really problems. Brain, MR, is for normal forgetfulness that manufacture needless terror. Stress tests that launch cascades of invasive procedures over nothing. And colonoscopies past 75 that can carry more risk than reward. Notice the pattern running underneath all 4? One test triggers another, then a procedure, then sometimes a complication. And somewhere in that chain, we forget to ask the only question that ever truly mattered. Is this person actually better off because of what we just did? After 22 years in medicine, here is what I have come to know in my bones. Health is not a perfect set of numbers on a lab report. Health is function. It's being able to do the things that make your life feel like yours. Enjoying your grandchildren, taking your walk, reading your book, living without a shadow of fear hanging over you and without interference you never needed. The goal at 65, at 70, at 80 was never simply to live longer. It is to live better, with independence, with dignity, with joy still intact. And sometimes, protecting that means having the courage to say no to a test that leads somewhere you never needed to go. I am not telling you to avoid medical care. I am telling you to become an informed patient. When a test is recommended, ask why. Ask what happens if it finds something. Ask what the real risks are. Ask if there's a gentler alternative. Then decide based on what actually matters to your life. You are in charge here, not the protocol, not the computer reminder, not the generic guideline built for someone else's body. You. Before you go, I want to ask you something, and I genuinely read every single comment myself. Has a doctor ever pushed you toward a test that, deep down, didn't feel right? Tell me below, because your story might be exactly what someone else watching needs to hear today. And if this changed even one decision you're about to make, follow along because there is so much more I need to share with you. Things most people never get told until it's too late to ask. Take care of yourself. And remember, sometimes the healthiest decision you will ever make is the test you chose not to take.